Okay, well, I'll get us started. I just want to again thank everyone for joining us this evening, and a special thanks to Susan Van Epps, who's the Division Manager for Programming and Community Engagement for the Loudoun County Public Libraries. Thank you, Susan, for scheduling this program and for inviting us to speak with everyone. The PowerPoint presentation that I'm using tonight will provide automatic captions. And I hope that you can view those on your screen. The presentation is going to be about 45 minutes, and we will leave time at the end for Q&A. And so I'm going to start us off, and my colleague Debbie Jones is going to talk to you about assistive technology in a little bit. I'd also like to ask you, when the presentation is over, you're going to be sent an electronic survey, and I'll ask you to just take a minute or two to respond to those questions so that we know how we're doing, and we know if we've done a good job, and we know how to do better in the future, so we can get started. Okay, so as you heard, this is our presentation, the hearing health tips for a healthier, happier you. And NVRCs mission is to empower deaf and hard of hearing individuals and their families through community involvement, education, and advocacy. And the way we do that is by providing information, training, support, fact sheets, free hearing screenings, one-on-one consultations, and support for people who are deaf or hard of hearing, late deafened, or deafblind. Today, we're going to cover these areas. First, the most important thing, of course, is to recognize whether or not you may be a person with hearing loss. Some people start to know when that is happening. Some are not aware of it. Every day when I meet people, at least half of them tell me that they're there because someone in their family, a loved one, told them they think they might have hearing loss. So first is just, how do you recognize some of the signs? Then you want to understand how hearing loss applies to you specifically. Also, we want to learn how to manage the hearing loss, which has to do with different communication strategies. And again, like we said, assistive technology. And the last piece is to self-advocate. And what I mean by that is, not only do you have to try to have different communication strategies, but the people around you should be trying that as well. And when you're in a facility like a library or a senior center or a community center, there's some obligation that they have to provide you with accommodations. And I'll talk a little bit about those as well. We have a good deal of information. If we were together in person, I would have some of this information for you. However, a good deal of it is on our website. And if you'll have our contact information at the end of the presentation, you can also find us on our website. If there's a particular subject that you're interested in and you would like information, please feel free to send me an email. Let me know what it is you're interested in, and I will follow up by providing you with some fact sheets. If you want to talk at some point with Debbie or I, you can contact us as well, and we can set up time to spend with you. So this is why this is such an important topic, because whether or not people realize it, a hearing loss can have a very broad impact. It can lead to social isolation, and social isolation can easily lead to depression and anxiety. Hearing loss is actually connected with increased risk of falling. Part of that has to do with the fact that your ear and the part that controls your balance are all connected. Part of it has to do with the fact that when you're not hearing as well as you should, you kind of lose your orientation with your surroundings, Or you might be so engrossed in trying to hear things that you become less aware and thoughtful about your movement. So all of these things can lead to greater increase in falls. Another significant area that has been found in the research is cognitive decline and the connection, the relationship between that and people with hearing loss. And then, of course, there's the issue of dependency. And again, if you are more and more dependent on the people in your environment because you're not able to hear and communicate for yourself, there's a likelihood of resulting depression. These are some signs that you may be experiencing a hearing loss. If it seems like people mumble all the time, if you have to ask them to repeat what they say, if women and children's voices are harder to understand than men's, if people complain about how high you have the volume on your TV, if you realize that people are speaking around you or to you, but you're having trouble understanding what they're saying, if you have ringing in your ears or other strange sounds, if it's hard to follow conversation in noisy environments. Now that many of us are finally starting to get out of our homes and be able to go into more social situations, some of us may find that it's much more difficult to hear when there's a lot of other things going on. If you're having trouble following the dialogue on your TV, and like I said at the beginning, if someone is telling you they think you might need a hearing test. And if you notice yourself that you're choosing to spend less time socializing with friends and relatives. These are some things that may cause a hearing loss. One is noise. It could be an injury to your head, an illness, medication to treat an illness. There can be a tumor on your nerve that is preventing the hearing, even though the rest of your hearing may be intact, and aging. Proboscis is a name for age-related hearing loss. And what happens is your hair cells in your cochlea, which I'll show you in a minute, begin to die off. They do not rejuvenate themselves. And they're usually the hair cells that are closest to the entrance of your cochlea. And those are the hair cells that interpret high frequency sounds, which are the speech sounds, the consonants for the most part. And that's why the speech starts to get muffled and harder to understand. So back to what I was saying, the parts of the ear. The first one on your left is your outer ear. That's the part that you can see. And that continues to the tube in your ear. And that's where you can collect fluid when there's an allergy or an ear infection. Your middle ear consists of 3 bones. They're the tiniest bones in your body, and what's called a window, the oval window. So up until that point, sound is simply going into your ear. The bones are keeping it continuing to vibrate and travel to your inner ear. And your inner ear is that circular shell-looking object that you see, and that's what the cochlea is. So in that cochlea is where you have hair cells that interpret the meaning of all the different sounds that come into your ear. And then that sends that information up through your auditory nerve, and that's where your brain interprets what you're hearing. The types of hearing loss, if it has to do with your middle ear, it's called conductive. And as I said, that can result from wax or fluid building up. And often that is just a temporary situation. As a matter of fact, when you go to an audiologist, the very first thing they should do is they will give you a physical exam of your ear, because before they do any testing to see if there's hearing loss, they want to make sure that there's nothing in there interfering with you being able to hear, or nothing. If there is it something they can send you to your doctor to have it remedied. And then your inner ear is what's called sensory neural loss. And that could be either those hair cells that are damaged or the nerve that carries the meaning up to your brain. That is an area that cannot be cured. And that's where you look for hearing aids or other assistive devices to help out. So how we measure hearing is there's two parts to sound. The top part, you see the squiggly lines, those are air waves. And the more of those waves that occur within a second, the higher the pitch of the sound. And when you see the more spread out, those are low frequency sounds. The bottom one is showing you the decibels, which we think of as soft and loud. So the smaller amount of decibels to your left in the green, that's the softest sounds. And then as it progresses, you get the much louder sounds. And the air is, the way air is made to move is the amount of force that is put on the sound so that it can travel through the air. So when you have a hearing test, you get a result that looks like this. So you may have already experienced going to an audiologist, sitting in a soundproof booth. They make lots of different beeps and sounds. If it's a very low frequency beep, like a deep sound, it's going to be in that lower number range, the 250 range. If it's a high frequency sound, it's going to be up there with 2,000 and 4,000 and 8,000. And this particular audiogram really is showing an example of what could happen during age-related hearing loss. So you can see the very low frequency sounds are still what we consider the normal range of hearing. And as it's progressing, it's going into a little bit of a hearing loss. This is another graphic of an audiogram. And what this is showing is a speech banana. That yellow banana looking object is what we call a speech banana. So you can see there how loud different things are in the environment. You can also see the frequencies that pretty much create different letter or speech sounds that we hear. And so if you look to the right, if you look at where there's an SH, a sh sound, or an F or an S or a TH, those are typically, again, related to age. And by the way, I should say noise-induced hearing loss is very similar to age-induced hearing loss. So many of us who listen to very loud music when we were in our 20s may be just experiencing that kind of a hearing loss. But anyway, when there's a loss in those higher frequencies, then it's going to become harder and harder to distinguish one word from another. So as an example, here are three friends on a bench, and one of them says, "It's windy here." And the other one says, "No, it's Thursday." And the last one says, "I'm thirsty too. Let's make tea." And so you can see how this message got reinterpreted as it went along the chain, because those high frequency sounds were hard to interpret. So without these consonants, of course, this goes back to the signs we talked about. Words are going to sound muffled or garbled or distorted. It's going to be like listening to a foreign film without the subtitles. And when you have a high frequency loss, it can be challenging to hear people with higher voices or accents. And it'll be more difficult to hear when more than one person is talking at a time. or when there's poor acoustics, which means that sound may be bouncing off the walls and it's coming back at you. So it's as though more people talking. And then if you're not familiar with the topic that's being talked about. So again, if you're not hearing or understanding, you are likely to experience fatigue, and even headache and frustration, which is going to encourage social isolation. So we need to learn some strategies for managing that. One solution, of course, is hearing aids. And this is a conversation you have with a licensed professional audiologist. You can see there's many different styles. Sometimes the style may depend on just personal preference. Sometimes the style may depend on what you want the hearing aid to do. Certain hearing aids are going to allow for more functions. You can see they vary in size. And so sometimes it will have to do with what you want your hearing aid to be able to do for you, how many switches or programs you want in it. And again, that's something that your audiologist should be an expert at discussing with you. By the way, a good audiologist is going to look for the best hearing aid for you. They're not looking to just represent one particular manufacturer or company. They're looking at what is going to work best for you. The one hearing aid we don't recommend is what we call in the drawer, which means you bring it home, it doesn't quite work, you don't like the way it sounds, it's too loud for you. All these things can go wrong and often do, and you need to be, this is where we come into the advocacy piece, because you need to feel confident to go back to your audiologist and make sure that they adjust the hearing aid to your particular needs and your satisfaction. So much so that I would even say that if your audiologist is not on board with doing all of that, I would recommend that you look for another audiologist, because they would be well aware that it's a process and that it could take a little bit of time for you to feel just right with your hearing aid. How hearing aids can help: they do make sounds louder. They are usually the most helpful in one-on-one conversation. They can help you locate sounds, which again, from what I said earlier, not being able to be fully oriented to your environment can create a problem. And that relates to helping with balance. And they create a more natural stereo effect because you're hopefully hearing the way you used to when both ears were functioning at the same level. Within a hearing aid, and this is what I was saying before about what functions your hearing aid can perform. Within a hearing aid is usually something, and if it doesn't come that way, it can be adjusted, is something called a telecoil, which was initially created for the use with telephones and now works with a loop system, which I will show you what that is in a minute. The other thing that hearing aids are equipped with is Bluetooth. And Bluetooth is what enables you to communicate with devices wirelessly. And each of these are different, and they each are equally valuable, and they serve different purposes. So it's important not to be told that you only need one or the other. It depends on what you want to do with your hearing aids and what devices you want it to work with. And so that telecoil works with a loop system. And a loop system is, as you can see that picture, the blue line on the bottom there, it is either a loop that can go around an entire room, or it can even be used in one spot within a room. And what it does is a person speaking into a microphone, which then goes into the loop system. And then the sound is transmitted directly into somebody's hearing aid. as long as the hearing aid has the telecoil. And so without having any wires connected to you, you're going to be able to hear the speaker as though they were standing very close to you, and it will eliminate some of the background noise that you would otherwise be picking up. And see, that's the telecoil that it will work with. So there are some things hearing aids do not always do. They may amplify sounds, but they may not always provide clarity, because once your hair cells are not able to interpret sound, amplifying will not necessarily help. But there are still some sounds that just by making it louder will help for you. It will not always overcome background noise. That's why we use devices like the loop or FM systems, which Debbie is going to talk about. And hearing aids alone will not always overcome distance. But again, that's where those Bluetooth devices or the hearing loop can help overcome. And they will not always help with challenging speech patterns. But that is something that maybe people you talk with can work on if you need them to slow down, if you need them to enunciate a little bit better. You might be able to overcome it that way. So here's some hearing aid humor. One friend says to another, I got this great new hearing aid the other day. And his friend says, are you wearing it now? And he says, yep, it cost me $4,000, but it's top of the line. What kind is it? $1,230. So here's somebody with a hearing aid, and he could just be getting used to it. So he didn't quite hear what his friend asked him. On the other hand, this could go back to what I was saying before. Yes, maybe it cost you $4,000, but maybe it's not doing everything for you that you were hoping. That again is your trip back to the audiologist to make sure that everything is in good working order. And now I'm going to ask my colleague Debbie to come on and talk to you about hearing assistive technology. Debbie, let me turn my video off. Okay.
Okay. Good evening, everybody. My name is Debbie Jones, and I'm the technology manager here at NVRC, which mostly means I get to play with all kinds of gadgets and toys. So let's talk about some of the hearing assistive technologies that can be helpful for you, both with hearing aids and without.
Do I need to
Yes.
advance for you? Sorry.
Yep, that's okay.
I'm on it.
So often you'll see assistive technologies kind of put into categories where you have devices that are used for communication, listening devices, telephones, that sort of thing, and then alerting devices, devices that let you know what is going on in your environment. And I'm also going to talk a bit about the Technology Assistance Program that the Commonwealth of Virginia provides to help folks who are dealing with hearing loss get these specialized telephone and signaling devices at a lower cost. So first, let's talk about telephones. Staying connected with family and friends is really important. So you want to find a good quality amplified phone that meets your hearing loss needs. These phones have amplification. So generally they boost, usually it's within a range. You may see up to 35 decibels, up to 40 decibels, or up to 50 decibels. The bigger the number, the louder it will be. And of course, it has volume control. These phones tend to have tone control. So as Joan talked about, knowing where your hearing loss is it in the higher frequencies or the lower frequencies? By adjusting those tones, you can boost the tones that you still hear well in order to understand better. So it gives some clarity to the sound that you're hearing. These phones also often have very loud ringers that you can adjust the pitch to high sounds or low sounds, and often have what is called universal design. So if it works for someone with hearing loss, it may also have large, clear buttons on the numbers for folks who also deal with vision issues. You can get these both in corded and cordless now. So depending on what your needs are at home. Sometimes, no matter how much you boost the volume or adjust the tone, you just can't understand somebody on the phone. It's a challenge. So that's where captioned telephones come in. These are special telephones that have a screen built in to the telephone, and it gives you a printout of what the other person is saying to you. And you can still hear their voice through the handset, and you simply speak your response back to them. But everything they say to you comes up in print on the screen on the phone. There's a special operator involved, but you never talk to that operator. You never have any kind of communication. They're only there to listen to what the other person says to you and make sure you get a printout of that. These phones also generally require you to have a phone line and an internet connection to have the best connection for the captions. Of course, so many of us no longer have a landline at home. That's when folks are starting to use their smartphones for everything. They live on their mobile phones, their mobile computer. But when you're dealing with a hearing loss, you have to consider how compatible your smartphone is with your hearing aids. Do they have telecoil compatibility? Most cell phones have what is called an HAC rating, hearing aid compatibility rating. There'll be two numbers that are a letter number combination. M is for microphone and T is for telecoil. So depending on how you use your hearing aid and what programs you have to connect well with a telephone, you want to look for those ratings on the smartphone or mobile phone that you're looking at. Now, very often, if you go to the cell phone store, the folks that you chat with are not going to know what that is. What you want to do is ask to see the box that the phones come in, because on the side where that has all the specifications, that's where those M and T ratings are going to be. It's generally a number between 1 and 4, and the higher the number, the more compatible it's going to be with your hearing aids. So if you find a phone that's an M3 T4, that is a really good compatibility, because it's not going to cause feedback and buzzing when you put your phone up to your hearing aid. So that's something to consider. There are devices made specifically for listening to the TV. Generally, these hook up to the audio out jacks of your television set, and they are generally wireless, either infrared or FM, that let you sit across the room, but it brings the sound directly to your ears. This could be a stethoscope style that you put, the earbuds in and it hangs under your chin, or it could be headphones that sit on top of your head. Or if you have that telecoil function in your hearing aid, you could use a neck loop that sits around your neck and gives that direct feed to the telecoil that's in your hearing aids. Personal amplifiers are great devices for those one-on-one situations. Maybe you don't feel like you are ready for hearing aids yet, but you need some kind of amplification when you're chatting with folks. These are great for one-on-one communications or small group, like when you're playing cards with friends, doctor's offices, riding in the car. These allow you to control the volume of what you're hearing. They have a microphone built in and generally can be used with a couple of different earpieces, whether that's headphones, again, that sit on the head, or earbuds, maybe one or both, or a neck loop if you have that telecoil function in a hearing aid. Because again, this can help block background noise. The microphone, it's not directional, but it picks up what's closest to it first. So now you've got devices that help you communicate, but you still need to know what's going on around you. That's where alerting devices come in handy. There are devices that can let you know when the phone is ringing, when the doorbell is ringing, when the baby is crying or dogs barking. These devices pay attention to the environment for you and give you a signal as to what's going on. That can mean a very loud alarm, say for the ring of the phone or an alarm clock, or it can flash the light instead of making sound to get your attention. There are different kinds of alarm clocks that can be very loud or flash the light or even shake the bed to wake you up in the morning. Some of them can do all three, and you can pick and choose what's the right kind for you. There are even Bluetooth bed shakers now that you can use with your cell phone. You sync it, set the alarm on your cell phone, put the bed shaker in your pillowcase, and when the alarm goes off, it shakes your pillow to wake you up. NVRC has a demonstration room, and we invite folks to make an appointment to come out and see some of the kinds of devices that might be helpful for them, whether that's telephones, communication devices like the personal amplifier, or signaling devices. Our center doesn't sell any equipment, so this is only demonstration, but then we can assist you in finding the places that do sell them or applying for devices through the state's Technology Assistance Program. You can get in touch with me. Email is generally the best way to reach me, and I'll add that to the chat as well. I did mention earlier that the Virginia Department for Deaf and Hard of Hearing has the Technology Assistance Program. This program helps provide telephone and signaling devices at a lower cost for Virginia residents who are deaf, hard of hearing, deaf-blind, or who have speech disabilities. It is an application process, and so the program looks at how many people live in the household and the monthly income for the entire household to see if you qualify for free equipment. If you qualify for the free equipment, you get to take it home for 30 days, try it out. If it works for you, you get to keep it. If it doesn't work, you get in touch with the specialist again and switch it out and try something else, and the 30 days starts over. If you don't qualify for the free equipment, you may still be able to get equipment through the state program at a lower cost. And so it's still worth investigating that as an option. For the Northern Virginia area, NVRC is the demonstration site for the TAP program. And so you can get in touch with me to ask any questions about devices that are available through the program, or for assistance rather in filling out the application forms. And now I'm going to turn it back over to Joan.
Okay. And so now to wrap up, I'm going to talk a little bit about communication strategies and the advocacy that I mentioned. So for communication strategies, they can be complex, and it's not just about your hearing loss. It's also the speaker, the listener, you, the environment, and the message itself. Sometimes you just need to let the person speaking with you, let them know what it is that you need. So in this case, could you please face me? I have a hearing loss, and lip reading helps a lot. You can ask, when you're the speaker and someone else has a hearing loss, you can ask them, what do they need? To slow down, to repeat, or rephrase. Sometimes I find myself that rather than just say the same thing over again that somebody's not going to understand, that by rephrasing it, it can make the communication clearer. And then again, you can indicate where you need that person to stand or sit if you have a better ear, and just that. And it's important to just admit if you're not hearing something, if you need something to be done, it's so much better for both of you, for your communication, if you just say what, let them know instead of bluffing and pretending like you hear them, but you really don't. So then here's the problem. What do you think you can do about it? If the music, the TV is too loud, can you make it softer or just turn it off? If the room you're in is too hot or too cold, you open or close a window or control the heat. If your environment is uncomfortable for you, there's a good chance that you're just not going to be your best hearing self at that particular time. You don't want to have light behind the person you're talking to. The person who has a hearing loss is going to have to rely on the facial expression and lip reading. And so you don't want to be looking into a window or a window with curtains open or a light source, because that's going to make it hard for you to look at the person's face. It might just be as simple as turning around so that you're not staring into the window. If too many people are talking at one time, is there any way to ask people to be quieter? Or sometimes what's easier is just to change your location and for you and your communication companion to go to a quieter spot. It's always good to confirm what you think you heard, especially when it's something important for you. So there might be some social situations where you might miss a thing or two and be okay about that. But if it's an important message about your health, about an appointment, about anything like that, you might want to repeat back what you think you heard and confirm. If all else fails, certainly you can ask the person to write something down. Something new or newer is all the apps that we have available on our phones. So both for iPhone and Android, there are two things. Debbie was showing you in her demonstration that there are those caption landline phones, but now there also are apps for telephones. When you make a phone call, you can get captions when the person speaks back to you. Also, there are phone apps that if you're in a person-to-person live conversation, just like the way our captions are coming up right now, you could have something similar on your phone, and that way you might hear better in a restaurant or a noisy location. And then finally, as I mentioned earlier, requesting accommodations. And this is where someone in a facility provides you with accommodations. And these are required under the Americans with Disabilities Act. So these are any number of accommodations that you can request. Sign language interpreters, assistive listening devices. Debbie showed you some of the devices that you could have and own and use for your communication. Well, in a public facility, it's also reasonable to ask them to loan you a similar type of device. You would just use it for that event and give it back, but it should be made available. You could ask certain places now, while we're all still having to wear masks, if they would, they will not necessarily give them out, but you could certainly ask them to obtain masks for their staff and their employees, so that when you go to do business or some sort of interaction, then they can wear those clear masks and help improve communication for you. Captioned movies and shows, those are available on all televisions now at home. And when you're going to watch a movie or a show in certain locations, you should ask them whether or not it has captions, and they can turn on the captions for you. There's also captioning during an event. So again, if Debbie and I were making this presentation in person, these captions would still be showing up on the screen. And by the way, if you go into a facility and ask them to provide any of these things that I'm talking about, if they're not sure what you're asking, you're welcome to contact us, and we would be happy to provide that information and explain what some of these things are so that they know what to get for you. Again, you know, in a facility, if there's an event going on, and if there might be a room that has better acoustics, one room than the other, or better lighting, it's very reasonable, if possible, for them to just move to a different location where there's better conditions for you. And then, like I said, the loop system. Now, like I said, some places they can be permanently installed, but there are also portable systems. So if there's a place you go to on a regular basis and they have not installed a loop system, they could be made aware of it and maybe will get one, a portable one that they can use when necessary. And again, if they don't know what a loop system is, we'd be happy to provide more information. There are actually facilities throughout the county that have a loop system, but they're not sure of it, or they're not aware of how to use it, and we can give them information on that. And this is just some encouragement, because sometimes the hardest part of getting used to having a hearing loss is the part where you have to advocate for yourself. So there's an organization called the Hearing Loss Association of America, and their name is on the bottom of the screen. You can look them up online under HLAA, and they're an all-consumer advocacy group. And they're national. And these are just some comments that other deaf or hard of hearing consumers left on their Facebook to talk about something that they realized as far as their hearing loss or their hearing health journey. So it's important to work with the right kind of professionals, let people know what you need, get the best hearing aids and or assistive devices for your needs. And all of these different strategies are going to help you live with your hearing loss. These are our contacts again. And I want to just remind you that if you do send me an email and tell me that there's a particular area that you're interested in, I'll be happy to send you some follow-up information, as well as, if necessary, we can make a one-on-one appointment to talk about your specific needs. And as Debbie mentioned, you can contact her to find out more about assistive devices and about the Technology Assistance Program. And these are some references that will give you some more information as well. So when we end this presentation, there will be an online survey sent to you, and we appreciate if you will take a minute or two and just respond to our survey. And now we have time for some questions.
Thank you so much, Joan and Debbie. This is Susan. I just wanted to jump in real quick and say thank you so much for the presentation. I learned so much. I had actually seen a presentation that was similar maybe 5 years ago, and I think there's so much that's changed in just 5 years with some of the technologies that are available. That was really interesting. So I think you answered most of the questions that came in, but we do have a couple. One is that one person said, there are lots of places that offer free hearing screenings. Are there better places to go than others to get your hearing screened?
Debbie, do you want to take that or you want me to answer that?
It's important to understand that a hearing screening is different from a hearing test. A hearing screening just gives you an idea of maybe you might be missing some things, maybe you're not hearing everything, and you need to go to an audiologist to get a full test. So yes, there's a lot of folks that can do a free hearing screening. But if you are really concerned about your hearing and what you might be missing, go ahead and make an appointment with an audiologist and get a full hearing test where they put you in the soundproof booth and they have you wear the headphones and you press the buttons and all of that.
That's great. That's a terrific distinction. I hadn't even caught that there's a difference between a hearing screening and a hearing test. So thank you for that.
Right.
Is for people who don't have insurance, but they're going to go to their audiologist to get a hearing aid, how do they know if they're paying a fair amount because it's so expensive and a lot of people have to pay out of pocket?
That is a challenge.
Well, I think it's important to note that it varies with every hearing professional you go to. So, and it varies with the different coverage that you have. So the best way to really find out is to talk to the hearing professional you're going to go to and find out what they are aware of that's covered. And also people should contact their insurance company. So I have met, by the way, NVRC, we can provide the free hearing screening, not the test, but the screening. And I have met, as I've been doing some of these screenings, I've met people who they have, say, Kaiser insurance, and they're getting everything paid for. I've met people who have Medicare, and their supplemental insurance is paying for their hearing aids. So it really varies. It really covers the gamut. So my best advice, I would say, is you need to talk to the provider, being the audiologist, but you also need to just talk to your own health insurance carrier to find out what they will cover.
Because some of them will cover one hearing aid every 3 years, or they will pay $1,000 per hearing aid. So you've really kind of got to read through or talk with the insurance company to find out exactly what they will cover. But we are seeing more coverage being included in health insurance policies.
And I just want to jump in and say one other thing that I neglected to say earlier. You made me think of it. I was saying how it's so important that the audiologist keep up with you and make sure that everything is working well and whether or not adjustments need to be made. I would say that in 99% of cases, if not 100, when you're given a hearing aid, you get a period of time to try it out with no obligation. So It could be anywhere from 45 days to even more than that. So that's another thing that I would make sure of when an audiologist does provide the hearing aids, that you have that built-in grace period to try them out before there's any payment required, or at least if payment is made, that a refund will be made.
Right.
Well, that's great to hear.
Yeah, under Virginia law, I believe by law, they have to provide 30 days. Some audiologists offer more than that. But I believe the minimum in Virginia is 30 days. And that's going to vary from state to state. So you really want to check into that.
Great advice. Okay, that's good to know. And then the last thing was, I thought the demonstration room looked really great. It looked like a great objective place to go see a lot of the new technologies that are out there. And I just wanted to clarify again where that's located and when somebody could make an appointment. Are you all available 7 days a week, 5 days a week, things like that?
Gotcha. Our demonstration room is based in Fairfax, Virginia. We're not far from the Fair Oaks Mall. So certainly folks can make an appointment Monday through Friday. Right now, we've got limited hours, generally between 10 and 2. But we could certainly work with you to arrange other times if those are not workable for you. And we can also, if you are not able to travel, we could also work with you to find either a location in Loudoun County, say a library or a senior center, where we can bring some devices out, or in certain circumstances, we can even meet at the home.
Wow, that's terrific. Well, Debbie and Joan, on behalf of the library, I just want to say thank you again very, very much for all of that great information. I think that this was a very useful presentation for a lot of people who maybe had been hesitating to reach out to somebody, and this will help break down those barriers and get them maybe to reach out and get some help that they need. So thank you. I'll let you have the final word if you have anything else you'd like to say.
I just want to thank you again, Susan, for arranging this. We're really dedicated to getting the word out, like you said. So I appreciate the opportunity to share what we know.
We really appreciate the opportunity.
Well, thank you so much. And thank you again for joining us. And thanks to our audience. And we will see you again soon.
All righty. Thank you.
Thanks so much.
Good night.
Good night.